Treatment for arthritis in knees is most commonly needed by people in advancing years. And while being older is one of the biggest risk factors for osteoarthritis of the knee, it can also affect younger people. It's possible that it runs in the family for certain people. For some people, osteoarthritis of the knee might develop as a consequence of a knee injury, an infection, or even simply being overweight. Here you will find information about osteoarthritis of the knee, including how it is treated and what you may do at home to alleviate the discomfort associated with the condition. A condition known as osteoarthritis, sometimes known as wear and tear arthritis, is a condition in which the natural cushioning that occurs between joints, known as cartilage, deteriorates with time. When this occurs, the bones in the joints begin to rub against one another more tightly, which results in a reduction in the shock-absorbing benefits provided by cartilage. The rubbing causes discomfort as well as swelling, stiffness, a reduction in the capacity to move, and, in rare cases, the production of bone spurs. Age is the primary contributor to the development of osteoarthritis in the knee. Osteoarthritis is a degenerative joint disease that affects nearly everyone at some point in their lives. On the other hand, the risk of getting serious arthritis at an early age is increased by a number of different factors. Age. As a person ages, their cartilage's capacity to mend itself becomes increasingly impaired. Weight. Putting extra weight on your body puts additional strain on your joints, particularly your knees. If you acquire 1 pound of weight, your knees will have to support an additional 3 to 4 pounds of pressure. Heredity. Among these are genetic variations that can increase a person's risk of developing osteoarthritis of the knee. There is also the possibility that genetic anomalies in the shape of the bones that surround the knee joint are to blame for the condition. Gender. The incidence of osteoarthritis of the knee in women over the age of 55 is higher than in males of the same age. Injuries caused by repetitive stress. These are typically the result of the kind of work that a person does for a living. Because of the consistent pressure that is placed on the joint, people who have certain jobs that require them to perform a lot of activity that can put stress on the joint, such as kneeling, squatting, or lifting heavy weights, 55 pounds or more, have a greater risk of developing osteoarthritis of the knee. This is due to the fact that these activities put the joint under a lot of strain. Sports. Athletes who participate in activities such as soccer, tennis, or running long distances may have an increased likelihood of getting osteoarthritis of the knee. That calls for individuals to adopt safety measures to protect themselves from harm. On the other hand, it is essential to keep in mind that engaging in regular moderate exercise helps to strengthen joints and can reduce the chance of developing osteoarthritis. In point of fact, osteoarthritis can be caused by weak muscles in the area of the knee. Individuals who suffer from specific metabolic problems, such as an iron overload or an excess of growth hormone, have an increased likelihood of developing osteoarthritis. What are the signs and symptoms of osteoarthritis in the knee? The following are some possible symptoms of osteoarthritis of the knee. A pain that worsens when you are active but improves slightly when you stop what you are doing and relax. Swelling of the knee joint. A sensation of warmth throughout the joint. Discomfort in the knee, particularly when you first get up in the morning or after you've been sitting for a while. A reduction in the knee's range of motion, which makes it difficult to get in and out of chairs or cars, use the stairs, or walk. The sound of cracking and creaking that can be heard whenever the knee moves. These symptoms will lead individuals to look for the best treatment for arthritis in knees. When treating arthritis in the knee, the primary objective of treatment is to provide pain relief and to restore mobility. During the course of treatment, one could utilize any number of different approaches, including the following. A reduction in body mass. Even a modest amount of weight loss, a few pounds, can have a significant ameliorating effect on the knee pain associated with osteoarthritis. Exercise. When the muscles that surround the knee joint are strengthened, the knee joint becomes more stable and experiences less discomfort. Exercising the knee in different ways keeps the joint agile and flexible. Medication. These are normally analgesics and anti-inflammatory drugs. You should always consult your physician before taking any over-the-counter medication for longer than 10 days. When taken for much longer periods of time, the likelihood of experiencing adverse effects increases. In the event that over-the-counter pain medicines are ineffective in treating your condition, your doctor may recommend that you take an anti-inflammatory drug or another medication that requires a prescription. Injections. Injections of corticosteroids or hyaluronic acid are administered into the knee. Steroids and other anti-inflammatory medications are quite effective in treating inflammation. Hyaluronic acid functions as a lubricant in joints that are otherwise healthy. Alternative or complementary health treatments. Acupuncture, topical treatments containing capsaicin, or supplements like glucosamine and chondroitin or same could all be beneficial in treating an arthritic condition. Knee braces. Braces may be necessary in some cases. Knee unloader braces are intended to ease the discomfort caused by arthritis by redistributing the wearer's weight away from the knee joints that are affected by the condition. Physical therapy. If you are having trouble with the activities of daily living, you may benefit from participating in physical or occupational therapy. Two of the most important objectives of physical therapy are to improve a patient's muscle strength and to broaden the range of motion that may be achieved in their joints. Surgery. When other treatments are unsuccessful, surgery may be an option. You'll be pleased to know there are many treatments available to help ease your arthritis. However, for the best treatment for arthritis in knees, just click the link below this video. You'll be glad you did. Go on, click the link.